Hi, I'm Kelly Dean from the Tummy Team, and we're going to talk about setting up a nursing throne. Our theory is that newborn moms are usually in the nursing position, that posture of nursing, 11 to 14 hours a day. So you deserve a throne. This is a great chair. There are a couple things you want to always think about. You want to be able to get on your sit bones where you're going to sit. The reality is you can sit a lot of different places, but you almost always sit majority of the time in one place when you're nursing, so you want that place to really work for you. So I have my bum all the way back on my sit bones, and I have a little pillow here. You can use a back support, something to give you a little bit of lumbar support. I love this chair because it comes all the way up to my shoulders and my neck, so the back of my whole body is supported. But I'm on my sit bones with my ribs and my pelvis aligned here. I'm not in this position like this, okay? So bum back, all the way on your sit bones, a little bit of lumbar support. Then you're going to want to bring baby up to you instead of you down to baby. Most people have some kind of little boppy. In the majority of the cases, this is not high enough for the baby, for you not to still round yourself. You can see how I round myself here to nurse the baby. So we have other options. You have a boppy and you can put another pillow. This is kind of like a little beanbaggy pillow. It's my favorite because you can kind of slip that underneath that and you can adjust this as needed for the size of your baby. Now, if you're at a 6-month-old, you might be fine here, but a newborn, you're going to need a little bit more support. The reason is when the baby's latched on, you want to be able to pull this pillow underneath and sit all the way back up, keeping the baby latched on and supported. So if we didn't have this, your arms are going to be supporting the baby and you're going to be rounding for hours and hours and hours a day, which really affects your upper back, but it also turns off the alignment of your core. So we want to get your transverse in a nice alignment so that you can keep it strong and start rebuilding it while you're healing from delivery. So we have the two layers, any kind. You can use a towel roll, anything like that to bring baby up. And then as the baby's latched on, you're able to rock or shift weights or kind of pat the baby using your arms kind of on your breast and on the baby's head and patting the bum without having to hold the baby. Two other things you want to think about. You want to, as much as possible, bring those elbows into the side. When your arms are out, your shoulder blades are rounded and your head is forward, and that leads to that bra strap area, back pain, and really, really tightened pec area, giving you that rounded kind of hunchback look. So shoulders back, elbows in, and then let your head rest back. If you are doing some nighttime feeding, it is nice. I'm not encouraging you to fall asleep while you're nursing, but sometimes we don't need any encouragement and we do kind of doze in and out, and then our neck is so tired from resting down. So sometimes it's nice to have a little neck pillow to kind of support your neck while you're nursing, while you're rocking the baby, so that your neck is not kind of constantly in this collapsed position but feels nice and supported. So you can get a little neck pillow pretty much anywhere, and that can be a nice little addition to your nursing throne. There's a couple other random things to think about with a nursing throne. The first thing is to put your nursing throne in the room that you nurse the most often. So if you have a great nursing throne in the nursery, but you rarely are in the nursery to nurse the baby, that's not going to be all that effective long term. Put the throne, the place that you're nursing the most, where you nurse the most. So if that means putting it in the living room for a period of time, put it in the living room. The other thing to think about is keep all the paraphernalia you need right there at your nursing throne, so that the temptation for you to sit and slump on the couch is very minimal when all of your stuff is sitting right in the chair that you need to sit in. It's nice to have a little table beside you or a little place where you can have your water, maybe a burp cloth, maybe your phone, whatever you need right there. And sometimes it's also nice to have a little extra basket of toys beside you that come out for the siblings while you're nursing, so that they have something to play with and they know that when mom's in this chair, she's feeding the baby. The other thing is, not everybody has an ideal chair like this, right? This is this is a great chair for a nursing throne. If the couch is the best you have, then you need to use pillows to get yourself back all the way on your sit bones, have back support, and prop baby up on the couch. Sometimes a dining room chair is a good option. Sometimes a chair that you would not be suspecting to be the best option is your best option. So test them out, kind of like Goldilocks, trying all the chairs to figure out where you can be on your sit bones, good back support for your lumbar and for your upper back, and having the right support to bring baby up to breast. Nursing is one of the things that you're doing the most in the first several months of newborn care, and so it consumes the majority of your time, and like our philosophy is, whatever you do, the most wins. You want a good alignment to win. Not to mention that at the Tummy Team, we start you rebuilding your core in your nursing throne. Not necessarily when you're nursing, but between feedings when you're patting the baby and you're upright and you're rocking the baby. This is an ideal position for the core to start activating and reconnecting after delivery. Now, if you are not able to nurse for various reasons, you still want to have what we call a mama's throne, where you sit. The thing about bottle feeding that makes it a little bit easier is that you don't have to position baby to breast the same way. You can have the baby more midline. The problem is that most bottle-fed babies, the mom always holds in their dominant hand, so it's very asymmetrical. So try to be encouraged to go both ways, or have baby facing straight forward towards you. Have some variety so your body doesn't kind of get locked in a pattern that's always one-sided. Okay, so those are some great tips for a nursing throne. It's really important, so set up your environment to work for you. Okay, there's lots more information at thetummyteam.com.